Hello, this is Jeremy, your friendly neighborhood pharmacist on Medication Minute with Jeremy. In this Medication Minute with Jeremy, we're going to talk about a hot topic as it gets warmer outside and everyone spends more time in the sun. How to protect our skin from sunburn and prevent cancer and premature aging of our skin. While we spend more time outside together, whether it is at the beach or just taking a walk in the sun, we need to remember how to protect our skin from the damaging UV rays. Some ways to protect ourselves are using protective clothing in shade, applying sunscreen properly, and taking supplements to help support our healthy skin. According to the American Dermatologic Society, about 1 in 5 Americans can develop skin cancer in their lifetime if they aren't careful. Every time we go out in the sun without proper protection, we are damaging our skin and risking the development of cancer. When spending time outside, it is recommended to seek shade when the sun is at its brightest, especially during the hours of between 10 a.m. and 2 p.m. Wear protective clothing, such as thin long sleeves and a wide brim hat to protect us from the sun, and applying sunscreen to any areas of our skin that we can't cover. Tanning in a tanning booth is also not advised doing, and instead you should be using self-tanning products. Just applying sunscreen to the areas that aren't covered is very important, but it's also just as important to make sure we use the right kind of sunscreen and that we do apply it properly to get the best protection. There are two types of sunscreen available. A physical sunscreen that reflects the sun's rays tends to be thicker and harder to rub in. It's the white pasty sunscreen and is best for those with sensitive skin. And we also have a second type of sunscreen that's chemical. It tends to rub in better and absorbs the harmful UV rays of the sun. When choosing sunscreen, it is most important to get broad spectrum, which protects us both from UVA rays of the sun, which cause skin cancer, and the UVB rays, which cause sunburn. We should also use a sunscreen that has at least a sun protection factor, otherwise known as SPF factor of 30, and try to get sunscreen that's also water resistant. Even though it says it's water resistant, it's not waterproof, so you need to make sure we'll still have to reapply that sunscreen. You need to use what they recommend is about a full shot glass of sunscreen to cover the whole body and rub it in entirely. You want to do this before you go outside because it takes a few minutes for to absorb into the skin a little bit and start providing protection. If you wait till you go outside, it's almost too late. You should still use it, but it's best to use it before you go outside to give it time to go into your skin. And it needs to be reapplied at least every 2 hours or after swimming or sweating, because it will come off as your skin gets wet. In addition to proper protective clothing, shade, and use of sunscreen, there are also some supplements we can take to help protect our skin from skin cancer. One of the most studied is vitamin B3, known as nicotinamide, but this is not to be confused with niacin or nicotinamide. They are different things and will actually cause the flushing of the skin. You can find this pretty cheaply in most stores. Take 500 milligrams twice a day. And it's been shown in some studies to reduce the risk of skin cancer up to 23%. Also, taking beta carotene is a very good vitamin, and it also helps promote general skin health and helps prevent our skin from burning as easily. This has been Jeremy with Medication Minute. If you found this information useful, and please like the video at the bottom and subscribe, and be sure to share all these bright ideas about how to protect yourself from the sun with others that you come in contact with. Until next time, stay safe and stay healthy.